usually be using local with epinephrine, so there's almost no bleeding. And then maybe you could have a Littler, do you have a pickups? So then you might do a little superficial dissection. So then there's basically one little thin layer of tissue right above the carpal tunnel, the sheath of the carpal tunnel, and that's that tissue right here. A couple little snips over there. And then what's helpful is, how about blade? We're white balanced already. So now you often would either have like a forceps or a small retractor just to pull that up. Okay, so now it should be in the carpal tunnel. So yep, here is, so I'm just going to move this. These are flexor tendons, you can see them move. And then the nerve is going to be on the thumb side. So that is the median nerve. And then that's the transverse carpal ligament for sure. That sort of, you can see the fibers going across, so that looks good. And then usually there's a transition where you see yellow, that's the palmar fat pad, that's the end of the carpal tunnel. So now we'll just do this. So here is where it would be helpful to have one set of hands. So maybe Sam, you could just hold the skin up there. And I'm just going to deploy the blade. So I would take this completely out in theory, right?
And I would say for this one, you have to make sure the blade is aligned on deployment. So
there we go. Yeah. Okay. Okay, so we'll make sure we just get the skin. Can you lift up a tiny bit more? Yep, good.
Good.
Okay. So now, and this is filming. I think it's okay.
Yeah.
In a live specimen, you often hear like a crunching almost. In a real, real way. But it looks like it's cutting well. So what's nice about the antegrade, you can back up and kind of see what you're doing a little better. So it looks like we're completely released here. So I'm going to put the blade back in. And let's just take another look. Yeah, and that's it. It looks like it completely released. That's the palmar fat pad. Maybe we can open this up at the end and just make sure we're fully released. But that looks good. That's the hypothenar muscles that, the thenar muscles and the hypothenar muscles that you would be cutting through if you did an open release. And remember before with the wings it was hard to turn, now it's really easy. So these are tendons here. You can see them kind of moving a little bit. And now you have good visualization. If there was like a transligamentous thenar branch of the motor nerve, you should be able to see it pretty well here. It's good resolution.
Can you change focus on this or no?
No, it's a fixed focus.
It's a fixed focus, okay.
And that's the end of the transverse carpal ligament. So that looks like a complete release. And that took like about 2 minutes. So good. Then, at the end of the procedure, you'd clean this up, put 1 or 2 stitches, and that's pretty much it. So that looked good. I thought that went smoothly. It was completely divided, and here's the median nerve underneath. So, fully released here, distally, and fully released proximally. So that looks good.